facilitating this Interagency Network for Education and Emergencies Community Conversation, which is designed to be informal and to promote discussion and networking opportunities around a specific topic. So you'll see here that the focus, based on our promotional materials that were provided by INEE, indicate that the focus of our community conversation is on the importance of care pedagogy as part of refugee educator teacher professional development. We have been working, Right to Learn has been working with the Area Studies Center in University of Peshawar on a TPD research project as part of a Global South TPD initiative called Empowering Teachers Initiative, or ETI. And it's been funded by the International Development Research Center. And that's the project we're going to talk a little bit about today. The agenda that we're proposing for our conversation will include a couple of short presentations. The first one from Right to Learn Afghanistan Senior Director, Murid Zaid, in which she'll talk a little bit about Afghan refugees in Pakistan, particularly during our research period. And then we'll also have a high-level summary of our research project with a short description of our model that took place in refugee villages in northern Pakistan by the principal investigator, Dr. Dinakel from Area Studies Center. And then we're going to move to the heart of our event, which is the discussion piece, where we'll talk a little bit more about care pedagogy and refugee educator TPD. And we have a number of questions, and we invite you to also bring your questions to us, and so that we can have a larger conversation globally about this very important topic. We have a few housekeeping points. We ask that you keep your video off and your microphone muted unless speaking to help those with limited bandwidth. And if you'd like to speak, please use your raise hand button in Zoom. The session, as you can see, is being recorded, and it will be available on the INEE website, any website after this conversation, I think later on today. And we'll talk about that at the end. And you can post your questions in the Q&A anytime. And if you have a question for a specific presenter, please note the name of that presenter in the question. Okay, so let's just see here. We've got more people joining. We'd like to actually take a few minutes because we have quite a large group here so far. And we'd like to just, because this is also a networking event, we'd like to also spend a few minutes at the beginning just getting to know a few people. So Natalie is going to move us into small breakout rooms. And I invite you to take a photo of this slide, because once you move into a breakout room, you won't be able to see it. And in that breakout, we'd like you to share your name and the position you work for in your organization or university, in the country where you work. And also, just as a little bit of an icebreaker, using this mood wheel, identify the best word to describe your mood today. So for example, it's very early in the morning for me here in Canada. And so I would say I'm a little bit, I'm a little bit sleepy, maybe. But please use this wheel to describe your mood for the day. So Natalie, I'm not sure where you are on organizing people. And people are continuing to join, but can you move us into breakouts? Hello, everybody. For those who are just joining now, I believe we're just in small, short breakouts. I think you're coming back now to the larger room. But if you're just joining us now for the first time, some people are in breakouts introducing each other using this slide to guide the conversation. But I think everybody's coming back out of their rooms now. Welcome back. I'm noticing that people have their cameras on, which I really think is so important, but we have a number of people joining us from low resource environments. So we do ask you to keep your cameras off if you're not speaking, just because of the global reach of this presentation, of this conversation. And I think everybody's back. Yes, great. So again, my name is Sasha Ennis. Welcome to our community conversation. We're focusing on care pedagogy, and as I noted, I hope that you all had a chance to introduce yourselves. I know it wasn't a very long time in the small groups, but the groups were quite large. So if you didn't get a chance to do that, and or if you'd like, please add your name and name of your organization and anything relevant to your work in the chat, because we'll collect the information from the chat as we proceed. And now I'm going to turn it over to my colleague, Maureen Zai, who's going to talk to us a little bit about the context of Afghan refugees in Pakistan, because that's the location in which we've been working on our research. So over to you, Maureen.
Okay, hello everyone. My name is Morwarid Zioi, and I also represent Right to Learn Afghanistan, the same organization as Sasha. I'm glad to be here today and joining everyone in this important on this important topic. I will start with a brief contextual overview to help us understand the scale of displacement, the living conditions, and what this means for refugee education in Pakistan. I will basically set the stage for the next presentation on pedagogy of care in Pakistan. So let's look at the broader displacement context. Afghan displacement is one of the longest running refugee situation globally, with Pakistan hosting Afghan refugees for over 40 years. After August 2021, around 600,000 more Afghans arrived. By 2024-2025, there are about 1.5 million registered refugees, along with a large undocumented population, many living in extended or even intergenerational displacement. This is a time of growing uncertainty, but changes in legal status and more pressure on undocumented refugees. At the same time, there is a strong push to integrate refugees into national systems like education, but they are often not explicitly recognized in policies. They are grouped under broader vulnerable populations, unfortunately. Next slide, please. So, what does daily life look like for Afghan refugees? Most are not living in camps. They are based in urban areas, often in quite challenging conditions. Many rely on informal or unstable source of income, which makes their day-to-day life a struggle for most of them. Legal and documentation issues play a significant role. These can limit their ability to work or move freely. And in some cases, families live with constant fear for being arrested or deported. And we have seen from then that the situation worsened later. At all of this connects to a broader structural barriers, things like poverty, child labor, limited mobility, and social exclusion. And these barriers directly affect education. We see lower attendance, interruptions in learning, and higher dropout rates as a result. Now, alongside these realities, there have been also important shifts globally in how education system responds. Um, since 2020, since 2018, actually, there has been, yes, please, the slide about global, yes, thank you. So there has been a global shift from separate refugee education systems to integrating refugees into national education system. What it means in Pakistan, this means that refugee students attend public schools and follow the national curriculum. This improves access and inclusion, but also creates challenges, especially with language barriers, as both students and most of teachers may not be fluent in the language of instruction. At the same time, education reforms in Pakistan focus on standardization through national curriculums like single curriculum, testing, the data systems like EMIS, which now includes refugees. While this is a positive steps, there are risks. The curriculum may not reflect refugees' realities, and strict accountability systems can unintentionally increase inequalities. Next slide, please. So overall situation of Afghan refugees in Pakistan. Refugee students face multiple barriers. For example, documentation requirements can limit their enrollment. The language differences are often not systematically addressed, which makes learning more difficult for them. Poverty is another major factor. It can lead to irregular attendance and even dropout in most cases. While integration policies exist, they often assume that access equals inclusion, which is not the case. There are also broader structural challenges. Discrimination is recognized actually, but not clearly addressed in practices. And frequent mobility can disrupt students' learning and continuity in school. And also altogether, these factors lead to quite fragile and unequal educational experiences for many refugee students. Next slide, please. So what are the implications? Overall, there are clear gaps between policy interventions and what students actually experience on the ground. Integration on its own is not enough. What needs to be done? We need approaches that address structural barriers, recognize diverse students' needs, and support both academic and non-academic aspects of learning. There's also a growing recognition of the need to center students' experiences, build trust and a sense of belonging, and respond more effectively to displacement and marginalizations. Next slide, please. So to conclude, Afghan refugees in Pakistan, they live in conditions of ongoing uncertainty with whatever is going on around them, as I mentioned before, with documentations and forced deportation and lack of access to education. While integration efforts are strong, key gaps still remain. These realities directly influence educational experiences and cause a lot of stress for both students and teachers. And I'm now handing over to my colleagues to share our research findings and discuss the pedagogy of care as applied in both Pakistani and Afghan refugees. Over to you, Dr. Dinakhil. Thank you.
Thank you very much, Murwarid. Let me briefly describe the project at a glance. This project was based in Khyber Pakhtunkhwa province in northern Pakistan and focused on Afghan refugee educators. It was implemented in two districts, namely Peshawar and Dir Lower. The central aim of the project was to scale the pedagogy of care among the refugee educators with the support of the relevant stakeholders, including the UNHCR Pakistan and UNHCR Khyber Pakhtunkhwa based in Peshawar. It was jointly implemented by, as already mentioned, Right to Learn Afghanistan, a Canadian organization, represented by Sasha and Murwarid and their colleagues, and the Area Study Center, University of Peshawar, Pakistan. Refugee villages, schools, they are like complex teaching environments where classrooms were diverse and under-resourced. So the focus was not only on improving teaching practices, but on embedding care within these challenging contexts. Next slide, please. Thank you. This project was implemented through several key components. The first is network improvement communities, hereafter will also be called as NECs. These NECs were small collaborative groups where teachers shared experiences, identified challenges, and tested their practical improvements. So, in this project, total 50 teachers who participated with equal representation of male and female and Pakistani and Afghan teachers. There were 7 NECs, Network Improvement Communities groups in total. Each NEC was facilitated by concerned education facilitator who was a university professor. Monthly face-to-face meetings of NECs were held regularly where teachers reflected, discussed, and connected theory to practice. Education facilitator, they were guiding the discussion, encouraging participation, and maintaining focus. Next slide, please. Thank you. One of the significant component of this program is the Pedagogy of Care course. This course was designed to build a deep and practical understanding of care in TPD, teacher professional development. Across the modules, teacher engaged with different dimensions of care, including their own well-being, their relationship with students, and inclusive and responsive classroom practices. The course also emphasized supporting students' social and emotional development, their mental health and resilience, especially within the challenging learning environments. Rather than focusing only on like theory, the course encouraged teachers to continuously reflect on their own practices in classroom realities. The final component, which we call the capstone project, like there were 8 modules, so the last module was the capstone project. This capstone project provided an opportunity for teachers to apply their learning and practices. And they use a PDSA, Plan, Do, Study, Act approach. They identified specific classroom issues. They tested strategies and worked toward improvement with the support of network improvement community groups and their respective education facilitators. Next, please. Thank you. This slide presents the first key finding from the pilot study, which address how teachers learned and developed professionally within the care-centered network improvement communities across differences of gender, culture, ethnicity, and location. The findings show that network improvement communities supported professional learning primarily through social relationships. They function as relational spaces or what we call social containers, where trust, a sense of belonging in a safe environment for sharing experiences were developed. This kind of environment enabled open discussions and the exchange of diverse perspectives among the teachers and participants. Importantly, teachers worked in mixed groups across nationality, gender, and language, and this diversity actually strengthened the learning process. Teachers were able to learn from each other's experiences and viewpoints. In this way, care was not only like something that was discussed as a concept, but it was also experienced and practiced within the network improvement communities themselves. Next slide, please. Thank you. The second key finding highlights a shift in teachers' understanding of what good teaching means. Rather than focusing only on delivering lessons, teachers began to see their role as creating safe and engaging learning environments. So, this shift in their understanding of the teaching, this shift was supported by the course concepts, particularly the focus on self-care as well as through fear learning and the opportunity to try small practices in their classroom. As a result, teachers increasingly recognize the importance of students' social and emotional well-being and observed the students responded more positively to care and kindness. Next slide, please. Thank you. This is from my side, this will be the final slide. And this will highlight key insights about the care in education and particularly in refugee context. Care needs to be promoted and questioned throughout the entire system, not just at the classroom level. Understanding the value of self-care is foundational for teachers to shape their care practices in the classroom. Inclusive and well-managed network improvement communities can create supportive and caring spaces for refugee educators. It is also important to provide a structured support to education facilitators before the program begins. So overall, this professional development approach, it shows that educators can change how they think about care and in turn support their students more effectively. Thank you for your attention. Thank you, Sasha. Now it's over to you. Thank you.
Thank you, Dr. Dinical and Maureen. Wonderful summaries of our work. I think, yes, everyone can see me and hear me. So as you know, the structure of a community conversation, if you've never been part of it before, is about sharing ideas. So we've given you a little bit of information about our work. Of course, we've had it's a 1 hour long session, so we haven't shared a lot about our findings or about the TPD program, and we're happy to field more questions about either of those areas. We also would like, as a global community, to talk a little bit about what's happening in your own context, in your own country. So we have a series of questions here. I'm just going to read through them, and if any one of those questions are of interest to you in terms of answering, or if you have any other questions that you would like to ask us or others in this group, this is the time to do so. We have about 25 minutes of this discussion period, and then we will move to sharing a few resources, including, if you're interested, more information about the course that we refer to because it's open access and free for anyone to take, and also any resources. So I think everyone can read this on the screen, but just to pique some interest here, just curious about how you've engaged directly with refugee educators in your work, and what do you think are the most significant professional development challenges facing refugee educators in your country? Maureen gave us a really nice summary of the context of Afghan refugees in Pakistan, and my guess is it's not that different in many other places in the world. So curious to hear from you about other experiences. I'm also curious about how refugee teacher professional development programs, and often they're reverted to training programs, can or do integrate care concepts, if you've had some experience around that, and how we can ensure that these programs engage with students in the classroom. And one of the areas that we've focused on our research, but we haven't had time to talk about here, is how we can scale these promising pilots through UNHCR and ministries of education, so that these pilots can be used, considering that educators are integrating into, and refugee students are integrating into, the national systems. This is an ongoing process. Can some of these models that we're using with refugee educators be shared with departments of education or ministries of education to be used with public education teachers who will be working with refugee students in their classrooms? So I'm going to pause here and hope that somebody would be brave enough to perhaps introduce themselves and talk a little bit about their own work in relationship to this space and this area. I have a few friends here that I might want to pick on. Let's see, is Fatima still here? And you might have some further questions about our work that you might like to ask. Go ahead. I think I can't quite see yes, Mina, welcome.
So, hi everyone. Hi dear Sasha. I hope you're doing well. My name is Mina Riakhil. I'm from Afghanistan and currently living there. Actually, I'm not in a type of those teachers, which is, they're living in other countries. But I taught Afghan girls for 2 years voluntary. And, on that time, I had many students that they were immigrants in different countries like Pakistan, Iran, and other countries. So basically, it was a great experience for me. But I think there was many things that, we could not consider there. Like by the help of these type of organizations and these types of seminars, we can improve our skills. We can improve our, teaching methods to help them increase their knowledge as well as their, awareness. And on that time, I think what was very difficult for them, one thing was time. Time was very difficult to set up, and they were living in other countries. I was living here, and they were in different types of knowledge. And for a teacher, I think it's very difficult to explain a specific topic, which students are live there, and they have different types of knowledge. They might understand your words, they might not. So it was a quite risk for me. And I really tried to increase their awareness in different topics. And I did one thing more. It was creation of my magazine. I created a magazine in English language because I wanted to increase their knowledge, increase their awareness in different types of topics. So I could publish it, but not completely. But I believe those types of magazine can definitely help them to do better. Even not only the students, also the teachers, I think. So it was my idea. Thanks for listening to me. And I think these types of magazines, books can definitely help students and teachers to improve their, education systems. Thank you all.
Thank you, Mina. And don't go away. I know I have a couple of other questions here, but just to ask you a question about when we're talking about care pedagogy, this concept of care
Yeah.
pedagogy, and it's a term that's been used two or three decades ago that applied to women's studies initially. How have you, if you're open to sharing, how have you shown how have you demonstrated care or caring with your students and with other teachers in your program? Would you be open to
So
sharing?
yeah, of course. Actually, on that time, like there was several classes. I was teaching in book organization, and it was my first time that I was teaching, and I had no experience before that. Uh, like on that time, I was trying to use my internet. Like for example, I was trying to find out some teachers that they were on LinkedIn, and I was trying to learn from them how they are trying to teach students because I had no experience, and it was really difficult for me to have more caring. And that was my experience. I was trying to learn from others. I also used TED Talk. Famous people were trying to explain something, every topics with details. And then I went there and tried to explain it to my students and also share my ideas with other teachers. So basically, it was challenging, but I did it. Thank you.
Thanks, Mina. And you're an example of a refugee educator. You're working, or an educator who's working with students who are displaced. And so your own well-being is what we've learned in our research is really important. Your own sense of your own mental health and social and emotional understanding of yourself really helps the way you engage with other teachers and students. Thank very much for sharing.
Yeah, welcome.
Okay.
Appreciate it.
Charity, over to you.
Hi, everyone. Thanks for calling on me. My name is Charity Burns. I am a teacher myself. I have a lot of experience both in the U.S. and in low and middle income countries. But I'm very interested in refugee education, and most recently, I was working for international NGO in East Africa, and I was able to visit and work with some teachers in a displacement camp in the Somali region there, in Ethiopia. And Actually, I wanted to bring up something that you just brought up, Sasha, which is the well-being of refugee teachers, how incredibly important that is. As somebody who has taught in the classroom for over a decade, everywhere in all kinds of contexts, it's so important that teachers are able to care for themselves in order to be able to provide that caring for their students and implement this kind of pedagogy. So what I was going to ask about, or just speak about, was that, and now I'm wondering, what in your findings came up about that? Was there a discussion? Did participants mention that, the need for that?
Thanks, Charity. It was a topic that we spent so much time on in our project, from the design of the course and the model, right from the very beginning. And one of the tensions that we needed to manage was this notion that, I come from North America as well. So Charity, you're American, I'm a Canadian. We have a very individualistic approach to well-being. It's actually an important industry here on this continent. But in collective societies like in Afghanistan and Pakistan, for example, especially for women, their role is really to care for others. So how did we manage? And we worked with half of our teacher group for our pilot, and we've done a number of other projects in this area, are women. And so we really had to figure out how to design the modules on the course to address that this is a very new area for many of our teachers, especially from our female teachers, understanding that in order for them to care for others, they had to, and from our perspective, and I want to emphasize this because this is not the case around the world, but from our Western perspective, it's important for you to first look after yourself. And this was a really unfamiliar notion. When it came to moving through all of the modules over an 8-month period of time, and looking and interviewing teachers after we had 8 modules. They talked about, as Dr. Denical mentioned, many different areas, but the teacher well-being module was the most important module for them. It was the most important module. What the module that came after that in terms of importance was the module on mental health, which was a step up in terms of looking at more severe situations that students might be experiencing. But we found that teachers were learning that for themselves and their own families. And I think through both those modules and then giving more strategies to teachers to how to demonstrate that shift and that understanding of caring for yourself and then caring for others, worked really quite well here. We were actually quite surprised by the findings in terms of teachers. This is an ontological shift or moving towards an ontological shift for them in terms of understanding the value of care in their environments. One of the things we're trying to propose at a policy level with UNHCR and onwards is the importance of teacher well-being being built into any PPD program for refugee educators in the future, because whatever the topic could be, teaching math, but we have to build this in to that, understanding the context of refugee educators themselves, and many of them being in very challenging contexts. So I hope I addressed that. And I don't know, Dr. Denical or Maureen, if you had anything else to add there.
Thank you, Sasha. Thank you, Charity, for your question. After the completion of the course, when we started collecting data and we started in-depth interviews with the teachers, so one of the questions which we asked from the teachers about the 8 modules, among the 8 modules, which one is like most relevant and most attractive for them? So all of the teachers, they were of the opinion that all modules, they were having contents of the care and well-being of the teacher, but one module, it was like directly related to the teacher's well-being and self-care. So all of them, they appreciated this module, and they said that before this, this pilot study, they were not aware of the importance of the self-care and teacher well-being. So when we received the feedback of the teachers, so all of the teachers, they appreciated this idea of care and self-care and well-being of the teachers. Thank you.
Thanks, Dr. Denical. Okay, I see Kay has her hand up.
Thank you. I'm gonna see, just a minute, sorry.
All
I mean,
right.
I the best.
Welcome.
Welcome. Thank you. I actually work with SIL in Cameroon, Africa, and I my experience is more with what we will call internally displaced people. So
Mhm.
refugees within their own country, not refugees that are from other countries, right? Because due to war or persecution and so forth, I really have been growing quite interested in trying to empower teachers. I love the term empowerment of teachers, especially in the area of self-care. Like, this is what I think I have observed. The teachers are in classroom settings that have lots of pressure cookers going on.
Mm.
And the pressure cooker is going. Well, the teacher is hearing all this, not knowing how to deal with that. And then we have the airplane concept of put on your oxygen mask first before you help the person. But yet, the teacher doesn't even know they are paralyzed. How do I put on my oxygen mask? I know you are demonstrating that from the front, yet I have these pressure cookers going on around me that are calling for oxygen masks themselves. So I wanted to hear, if what was your experience with your research, with what you did? Like, did you find the teachers feeling more overwhelmed? Because I feel like the process is more like a process, supposed to like a one time or two times or three times workshop. Like, I want to learn more so that I can help more others. And I also deal with train people with trauma healing. So I'm just curious as to what other things are you doing for teachers, so that is, I don't know, it's a process, right? It's not just a one-time seminar.
Mm.
I don't know if you get a little bit my common question.
Thanks, Kay. I love your metaphor of the oxygen. I think that's exactly what I was referring to earlier with Charity, around this notion of caring for others before caring for yourself, and not even being aware of your own needs in this case. With the respect to our teachers, yes, one of the benefits of the approach that we used was that it was over a long period of time, the TPD program. It wasn't a one-off workshop or seminar, or even the typical TPD training in with UNHCR in Pakistan. It's definitely present. They definitely have training support, but it's usually over 2 or 3 days, delivered at the beginning of the year, and definitely from a top-down perspective. So these networked improvement communities that Dr. Denico referred to, these groups, small groups of teachers, and they're like collaborative learning communities or professional learning communities, but with an intention of solving problems in the classroom. So they're more research-based, and teachers use research tools through the course to identify challenges in their classrooms. But the NICs themselves were a place, as Dr. Denico noted, as social containers where Afghan refugees at the time, in fact, so we had Afghan and Pakistani refugees working, Afghan refugees and Pakistani teachers working together in these NICs, sometimes for the very first time. It was the very first time that Pakistanis had actually appreciated the lives and living conditions of Afghans. But they were well facilitated by these university professors who over time worked and built in the notion of care themselves as university professors. We noticed our education facilitators shifted themselves around the concept of care, and that got moved into these spaces, these NIC spaces, which we learned over time created a sense of well-being and care just within the teaching community, these small groups. And then that really helped to move teachers to working differently in their classrooms. But the other piece that we've learned through the research was, and we did a mixed method, so we did some quantitative data collection and some qualitative data collection, but especially with the qualitative data collection, we realized that it started from the very beginning of the TPD program, the design of the program, where we integrated and brought in UNHCR colleagues and education facilitators to help us with the design and development of the modules. So showing a sense of working together right from the very beginning. And then it was the way that Marie and myself and Dr. Denicow engaged with the education facilitators that they told us really impacted the way that they then engaged with teachers. So that's why we use this concept of care all the way down, because it needed to start from the very beginning of the design of the program, right through down to the classroom. And it was an important finding because I don't think we had appreciated how that has to work in an integrated way. So I would say the NIC social containers over a period of time, we had many conversations with teachers in those NICs about the idea of care in their own homes, how they showed that and for themselves and then in their classrooms. So I hope I answered that question. We had one module on care in self-care in the 8-module program, but all of the modules touched on creating caring, inclusive environments in the classroom. Allison, lovely to see you. Over to you.
Thanks very much. And great to see you. So I'm just going to try to unhide myself. Thank you. Yeah, so really interesting to hear in kind of live about this project and also other people's experiences. And to respond to your first question, I'm working with Jigsaw Education on a project which is funded by KICS, GPE KICS, the Global Partnership for Education, on training, working with refugee teachers in 3 countries, Zambia, Chad, and Uganda, to give them an introduction to basic research methods so that they're able to do their own research on indeed well-being and agency and how that affects and is affected by their inclusion or not in the national systems. Obviously, and we're doing this in collaboration with UNHCR and in the context, as you say, Sasha, of refugee inclusion generally, children, learners and teachers into national systems in theory. So to kind of go through the questions, the professional challenges that these teachers face is of exclusion. In fact, first of all, not being paid. And when we're talking about or paid enough, we're talking about well-being. It's interesting that you're highlighting this idea of self-care as not being recognized. And I find that I relate to the idea. We've talked in terms of well-being, and that seems to be clearly recognised. And we've done a survey. The teachers themselves did a survey with over 500 refugee teachers in the different places where they're working, which indicated a very high correlation between stress and the lack of pay. It was the highest stressor is the lack of pay. So, of course, self-care is important, but self-care needs support. And if you don't earn enough money, so teachers are often, as I'm sure you all know, running several jobs. And in some cases, in Uganda in particular, where they've been particularly hard hit by the US aid cuts, teachers' salaries were either cut or completely taken away. So the teachers a number of them continued working without pay. So they're working as volunteers. And so I think that's combined with a lack of recognition for their own qualifications. So some of them who've come from countries where they've been working as teachers before, which is often the case. Obviously, the process of having those qualifications recognised is very slow, if possible at all. It often costs money. They often don't know how to go about that. There's not a lot of information around how to go about that, and they're quite often stuck in settlements where they don't have mobility. So these are many challenges that are being uncovered by the research that teachers are doing themselves, none of which is new, I know, but what we think is important about this project is that the teachers themselves are doing the research. And we have a couple of kind of initial findings. We still have a year to go, but what we're finding is that the 6 teachers in each country who were selected, so 6 refugee teachers, they're keeping reflection logs. And what's coming out very strongly from those once a month, they respond to a few questions about how they're feeling about the project and their work, etc. And they're highlighting the empowerment, we can put it like that they feel by learning more about research, being able to take a more critical view of their own situation, the opportunity to talk to other teachers, which they find has given them more insights into people from other places, a bit like as you found in the Afghanistan study. And so therefore the well-being it appears to be improved through the process of training. And I think that's intuitively true, we would feel, but it seems to be proved by the evidence of this study. And what we're trying to do in terms of the integration, working with scaling and integration into national systems, our objective is to have the training, which is a 4-week training on face-to-face complemented by online study, is to have that accredited within teacher training systems of the 3 countries. And we feel that this would be the most effective way to train it. So it would be a recognition for the teachers who've already participated. It would give them a qualification, a certification that's recognized within their context. And then to build this in, and I think this is what's really important, it's clear that care for me and self-care and care for your learners is part of good teaching. It's not a separate thing. It's part of well-being. It's part of inclusive quality education. And so making that part of the teacher training that exists in any context, I think, is a really powerful way to build this into the systems and to try, therefore, to get recognition and a greater understanding of the situation of refugee teachers amongst those in the education system more generally. And just one final point on that is that one of the findings from the survey, we included some teachers in one of the contexts who are not refugees to get a comparison, and they're expressing support also for the inclusion of refugee teachers in the system, recognizing their value, what they bring to the system, rather than being a problem for the system. Thanks.
Thank you, Alison, very much for sharing those. Those are preliminary survey findings.
Yes,
Yes,
we have,
wonderful.
and we're just in the process of qualitative data collection now.
Great. Yes, we did, of course, address, or I didn't address, but spent a lot of time discussing issues about compensation and inequity actually amongst Pakistani teachers and Afghan teachers in these collaborative groups. They themselves recognize that they are treated differently with different kinds of benefits and primarily the difference was job security. Okay, wonderful. Lots of good things happening in so many different places in the world, but I think certainly there is this sense from all those who have shared comments about the importance of care, self-care, and care for students, however that is defined in different contexts, and that is aligned with some of the findings that we've also found from our research. I'm bringing us to the end of our hour. It's gone very fast. And what I'd like to do here is just to share, I just want to emphasize, we won't go into this today because we don't have time, but just for those who might be interested, and I will put these links in the chat in a minute, but we have our organization, Right to Learn, has a platform for teachers and for interested adults to learn about many different topics. We are obviously supporting mostly educators and others who are needing to learn online primarily. So the platform we use Moodle, and we have a number of courses. One of the things that was interesting about this work was that our course was online. So this is a new way of working together with teachers. Many of them had never worked online before. So we also offered a couple of short courses preliminarily to help teachers to become better acquainted with how to use computers and also how to be safe online, which they did prior to taking the online course. And then we've just revised that course, and it's almost ready for public viewing. There's a link here that I can share with you for those who are interested. And then there's a number of excellent recent research over the last 5 years that's been carried out through ETI and others around the importance of actually using ICT, which we haven't talked about too much today, in TPD. And what we try to do is build in the element of care in that kind of context where teachers are learning remotely, but also bringing them together was an important element of their blended learning format and structure. So I'm going to leave it here, and I'm going to turn it over now to Natalie to pull this together in terms of some requests we have of you. Over to you, Natalie.
Thanks, Sasha. And I will also put my video briefly and say hi to everyone. So just to wrap up this event, the recording and all related presentations will be shared by email and also posted on the INEE website. So don't worry about that. And you can refer to that once we share it. We also want to hear from all of you, your feedback about this event. So if you could fill out this feedback form that's shown on your screen, that would be great. I can share the link to that with you now as well. Just a second. I will share it in the Zoom chat, but also it will be in the slides. But let me share it here. So it's shared now. So if you can spend a minute to share your feedback, we would appreciate it. And finally, I wanted to remind colleagues about our community of practice on Slack. This is a service that we offer all of our INEE members. The INEE Community of Practice is a wonderful platform that facilitates peer-to-peer communication and moderated discussions on the full range of EIE topics, including on teachers and teaching in crisis. So if you're interested in joining the platform and you haven't already, you can join by filling out a form, a simple form, which I'll share also through the Zoom chat. And it's there. And we hope to see you there. And finally, I wanted to mention to those of you who don't know, but INEE is going to organize next round of meetups in May. And similar to the community conversation, these are informal events, very participant focused, where we have volunteers presenting and discussing different topics in EIE and focus on various geographies around the world. So we would invite you to join one of these events if you're available. We will be posting all of these events on our meetups page. More information will be coming over to you soon. And of course, check our website for more updates. So that's all from me. And I thank all of you for joining, and especially to Sasha and colleagues for leading this community conversation. Thanks.
Thank you.
Thanks, Natalie. Take care, everybody, and welcome. We look forward to connecting in the future.
Thank you all. Take care.